The emergency room after delivering a baby. A new study finds women who used midwives for postpartum care instead of obstetricians had fewer visits to the ER. Here to tell us more is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General. Dr. Raja, great to see you.
You too, Erica.
All right, Dr. Raja, let's start with your ER. It's the busiest in New England. So what kind of health concerns do new moms typically come in with?
Ben, it can really vary. Obviously, giving birth is a life-changing event, and it can obviously lead to a lot of bodily changes. There can be soreness and some mild bleeding, but there can also be some really serious issues like significant hemorrhage or blood clots or preeclampsia or honestly, severe mental health issues as well. And while those aren't common, we always tell new mothers what to watch out for in case they develop, and sometimes we do see them in the ER for them.
Okay, so at MGH, women can choose whether they want to use a midwife or an obstetrician throughout their pregnancy. If you could go through the differences, and is there really much difference in terms of support?
Great question, Erica. You know, we've had midwives as part of the care teams here at Mass General for 30 years, and they help with family planning and during and after pregnancy and even gynecology visits. So they can do all that. And they work as part of the team that's led by our physician, obstetrician, gynecologists, who are real experts in high-risk pregnancies and pregnancy complications and surgeries. And so together they make a great team, and that support really is sort of wraparound by the entire team together.
All right, so in this recent study, Dr. Raja, it was based on 100,000 women in Canada. Obviously, they have a very different health system than ours, but what's the takeaway for us? What can we take away even though we have a different health system?
We do, Ben, but you know, there are some takeaways. So I read this study really closely, and in the study, basically about 6.5% of women who saw midwives at an ER visit in the first 6 weeks after delivery, compared to about 8.5% who saw obstetricians. But I'll tell you, when you look into the data, the midwives patients saw them about 7 times during those 6 weeks. And the obstetricians patients, they saw them 0 times. So it's not exactly surprising to me that they ended up in the ER. I think the real takeaway here is the importance of follow-up and getting in to see your provider to check in, regardless of whether it's a midwife or physician. Getting that support that you talked about is the most important thing.
Okay, Dr. Raja, thanks as always. Great to see you.
You too, Erica and Ben.
Thank you.